The sort of patients I'm likely to meet are the patients that are high risk, they're normally elderly and they normally have one or two maybe long-term conditions.
Carolyn Garvin is setting out for the day. She's a community matron working in and around Berwick. Her role is to support people with a range of serious conditions, helping them to live well at home.
How are you today?
A lot better, thanks.
Oh, good, good.
Today, Carolyn is making a weekly visit to Irene Borthwick. Irene was regularly spending long periods in hospital as a result of the lung condition COPD, coupled with diabetes and rheumatoid arthritis. With Carolyn's help, she's now managing her health at home.
Caroline's like a friend, really. Every Monday morning she comes in. I can talk to her about anything. And it must be helping the national health. When I was in Wandsbeck, for 3 weeks, the money it would cost for that, whereas now Carolyn coming in, there's a big difference.
Carolyn is one of around 200 community nurses covering Northumberland. The Berwick team alone makes at least 50 visits a day. Because of her skills and ability to prescribe medicines, Carolyn has taken on some of the work traditionally carried out by GPs.
It's having that personal relationship with a patient, which you obviously build up over time. And it's for the patient that they have a sort of a key person that they know, knows what their condition's normally like, and that they can call in an emergency.
It's an approach praised by a charity which campaigns for better healthcare.
There's a huge amount of care going on in the community. It keeps people well, it'll keep people out of hospital. There are well over 1 million hospital attendances, emergency attendances, which could be avoided with better community care. So community care is vital, but we need to know more and value it more.
The ethos of community nurses is prevention rather than cure. That's also the aim of a scheme on Teesside to reduce the region's high rates of bowel cancer.
Okay, feeling a lot better?
I'm feeling much better.
Tom Boyd-Smith was diagnosed with bowel cancer last summer. He'd had no symptoms and told me the tumour was picked up through the NHS's regular screening programme.
Because of the early diagnosis, the operation was quite straightforward, and I had no need for any follow-up, no chemotherapy, nothing after that. So you can imagine I'm a very keen advocate for people that they should do the test.
Across the country, people over 60 receive a testing kit every 2 years so they can provide a sample for screening. Here on Teesside, the programme has gone a step further. At the age of 55, everyone is invited in for a 10-minute camera test, which aims to detect precancerous growths. As a result of that test, more than 3,400 people have had precancerous growths removed. That's on top of more than 600 cancers detected by the regular screening.
If we can get in early, prevent the cancers from occurring, or at least detect them at an early, easy to cure stage, then we do the patients a big favour, of course, and we also save the NHS a lot of money.
You will be receiving another screening kit in about a year's time.
Tom Boyd-Smith is in good health thanks to the bowel cancer screening programme. But those involved say its wider success relies on more patients taking up these tests for the benefit of themselves, their families and the NHS.